Hi, I'm Dr. Julie Steinauer, and from time to time we get this question of, why don't you just tell me what I need to do to correct this thing at my home? Can't I just correct this vision problem that I'm having all by myself? And I'd like to address that question with you today. Now, let's go back for just a second. Let's talk about how you can connect with us. If you're local to us, please give us a call at 618-288-1489. If you're not local and maybe you're in Thailand, and you want to connect with us about how we could potentially help you, then you can go to our website at visionforlifeworks.com, and you've got two choices. You can either schedule a consultation with me directly, or you can click on the button that is fill out a questionnaire. What that will do is it will start a process of emailing with us. Now let's go back and talk about why we don't recommend that you try to do everything on your own to fix and correct your vision. Now, some of our patients will say, I'm amblyopic and I'm not seeing very well in one eye, so I've been following these, XYZ videos or whatever online. I've done a couple of things. I actually got a little bit better, but now I seem to be kind of at like this stalemate. I'm not really seeing anything change. Or maybe, my child's got a tracking problem. We kind of did some things online. We did this program. We worked on this. We worked on that. But now we're kind of just at like a plateau. All right. I understand those types of situations. There are obviously many reasons why people may begin to start looking into ways they can help themselves. And we applaud you, first of all, for doing anything at all to try and improve your vision. But let's talk about why it's really important to have the guidance of a doctor who's going to do that, rather than me just trying to tell you, well, you should do this, 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 and this to fix and correct your problems at home. See, most of the time, the only problem with seeing tons of videos online is it starts to make the process seem like it's a simplistic process. When in many cases, in fact in most cases, like strabismus, which is an eye turn, amblyopia, where the eye doesn't see as well, maybe a visual field defect as a result of stroke or traumatic brain injury or concussion. Those are situations in which there might be some things you can do online to make it a little bit better, but if you really want to have your best results, you need to be under the guidance of a doctor. Because first of all, we've trained for a lot of years to know what the heck we need to do to correct your vision and help you to get better. Or if it's not correctable, we want you to get better. And so you could beat around the bush or kick the can down the road for the next 6 months, a year, 3 years, 4 years. Do you know the longest a person's ever kind of done this stuff on their own? Like 10 to 15 years. Sometimes I hear people like, well, we were patching and doing this stuff for like 15 years. Oh my gosh. And no one told you that you could actually have the help of a doctor to guide you? Makes me have eyes that are bleeding. Okay, no. You need the help of a doctor to guide you along the pathway, because you can have significant changes and improvement in your vision. Whether you have strabismus, amblyopia, a visual field loss due to stroke, you've had a traumatic brain injury, I could list like 80 other things. No matter what those 80 other things are, in addition to what I mentioned, if you have the guidance of a doctor who knows what they're doing and they've been doing this for a while, then you could potentially have some pretty significant changes and improvement within just a few months. Now, it doesn't mean that your case is solved in a few months, but you could have significantly better vision in just a few months. So, kick the can down the road for how long? On your own, versus get guidance of someone who knows what they're doing, has worked with, in our instance, thousands of patients over the last 20 years, and hundreds of patients in a year. Gosh, that's a hard decision, right? Okay, all right, so now if you are thinking, okay, Dr. Julie, you're beating me up. It's actually time that I get somebody's guidance. You're right, I give. Okay, if you're local, then give us a call at 618-288-1489. If you're not local to us, it doesn't mean we can't work with you. Go to our website at visionforlifeworks.com, and you've got two choices. You can either click on the schedule a consultation button if you're like, I give all up, I just want to do it all. All right, that's the schedule a consultation. If you're like, well, then that would be fill out the questionnaire so you can talk with us and we can talk about what the next steps might be. Now, if you like this video, like it, subscribe to our channel if you feel like it would be appropriate for someone else to listen to who's trying to do vision therapy on their own and they're not very successful and they've been beating around the bush for a couple of years doing it. Pass the video on to them. All right, thank you.